action.
Are you picking that noise up of the pool? Action?
There's no way for her to know. There's no way for her.
Oh, okay.
You know what I mean?
Yeah. Do we have to have that light? It is
I
pretty
think we should
good.
try
Light.
with it.
Okay, try with it. Okay.
Yeah.
All right, here we go. Well, 12 years ago, I came here to Dr. Bauman, and I said, hey, I'm starting to lose my hair. And you said, why don't you try this thing called Propecia? We know that it slowed the hair loss. But the one thing we've established is there have been a lot of developments in the last 12 years. So let's say 26-year-old Kevin is back here today, and I'm where I was 12 years ago with my hair loss. What else could I do other than Propecia to manage it? Because I probably didn't need a transplant when I was 26.
That's right. And most guys who are starting out with a little bit of thinning don't need transplantation right off the bat.
Mm-hmm.
What they need is some kind of preventative treatment
Right.
to stop the progression of the hair loss. And so Propecia is a good idea, but there's other things too.
Okay.
Topical medication like Minoxidil.
Okay.
Minoxidil is the active ingredient in Rogaine. Rogaine is readily available over the counter.
Uh-huh.
That's an old style recipe. Rogaine has been
Okay.
available for 20 years.
Right, yeah.
When Rogaine first came out, Ronald Reagan was president, your cell phone was as big as a briefcase,
Right.
and gas was 91 cents.
Yeah.
You know, okay, so technology has changed in the field of cosmetic chemistry as well
Okay.
as in hair transplants.
Mhm.
So Minoxidil can be made better
Oh, okay.
than Rogaine. Even Rogaine's easy, you just go to the store and pick it
Right,
up.
yeah.
We can make Minoxidil better. So compounding pharmacists
Mhm.
are amazing chemists that can help us make Minoxidil into a better compound that's easier to use on the scalp, has
Okay.
fewer side effects,
Right.
less irritating,
Uh-huh.
less messy
Right.
on the hair, and more effective for hair growth.
Now, is it possible that that's all somebody might need for their lifetime is just Minoxidil and Propecia?
Well, it's possible. Remember, Minoxidil and finasteride, which is the medication in Propecia,
Yes.
those are the two FDA-approved drugs.
Okay.
So, I mean, that combination can be pretty powerful.
Right. Okay.
Propecia alone works 90% of the time to keep people looking the same or better.
Right. Exactly. It worked 12
But
years.
it's
for me.
but Propecia's easy. One pill once a day.
Right.
Minoxidil is not as easy.
Okay.
Twice a day, every day is what's required if you're going to start a Minoxidil regimen.
Right.
So the best Minoxidil right now in terms of formulas is formula 82M.
Okay.
That's a compounded prescription version of Minoxidil.
And someone would need to come talk to you about getting on the effective dosage of Minoxidil.
Correct.
For that.
Unfortunately, Consumer Reports rated Rogaine as like the most disappointing hair growth treatment.
Yeah.
I mean,
I've tried it. It didn't
right.
do
A
anything.
lot of people try it. They don't know how to stick with it. They don't really know exactly what
Right.
they should be doing, and they also don't realize what the effect should be
Okay.
from the Minoxidil. So, if you're going to use Minoxidil, you should be under the advice of a physician and under a monitoring program, so we can show you exactly what it's doing, make sure it's working well.
Fascinating.
And that's
Okay.
what Minoxidil. That's what Formula 82M does.
3.
Good.